So one of the conditions that I think it's important for orthopedic specialists like myself to be aware of is something called the female athlete triad. The female athlete triad is a small component of what's known as reduced energy availability in sports. And what happens is sometimes in different sports, such as figure skating, gymnastics, lightweight crew, where your shape or size influences maybe your performance and how you score, these individuals will start restricting their caloric intake. And as a result of that restriction, they start to, or as it progresses, they can have low bone density or develop what's called amenorrhea, which is an absence of menstruation for girls that lasts more than 3 months. So when these things happen, it puts these athletes at risk for developing stress fractures and having poor healing, and they also can develop pretty significant anemia or vitamin D deficiency, which is going to affect their performance. And so as orthopedic or sports medicine providers, we're in a phase that we can check our athletes when they come in and every time they come to see us, and make sure that you're not seeing a decrease in body weight, or that their body mass index isn't getting so low that you think they might be developing this syndrome. And then if we do identify, the other way you can identify them besides just watching their weight is you can, if you're getting athletes such as cross-country runners that are developing recurrent stress fractures, this is also a time you should really think about screening for these syndromes. And so at Towson Orthopaedics, we use some screening forms to see whether or not our athletes have these problems, and then we try and work with specialists that can get athletes back on the right track.